But the most important thing on everyone's minds, I think, and what we'll hear a lot about today, is the vaccine. Stopping the pandemic, that's what all of our goals is. And to do that, it's making sure everyone can get the vaccine. Right now, the tier that we're looking at with healthcare professionals and people over 75, people in long-term care facilities, hopefully and soon we'll be able to open that up to more individuals. But our focus has been particularly on those most vulnerable, and that's all of our county services always go with a priority to those who are most vulnerable. If you're over 75, you qualify to get that vaccine, and I want to make sure it's easy for you to get that. We all do. There's an online way of signing up to get the vaccine at VenturaCountyRecovers.org. There's also a phone number you can call, and I've asked them to put that phone number up. The phone number to call so you can sign up for a vaccine is 805-477-7161. Again, 805-477-7161. Get out a cup of tea, read the paper. You're going to be put on hold. You're going to be put on hold for a long time. Stay on hold. Get yourself signed up. Get comfortable. You will get the vaccine, and I want to make sure you can get that appointment. So please be patient. Stay on hold. Get yourself that vaccine, or go to the website, VenturaCountyRecovers.org. You can sign up that way too. We are obviously at a situation where the supply of vaccines doesn't meet the demand. We're going to continue to roll out that vaccine, and what I'm most proud about on the vaccine front, of all the counties in the state of California, we are at the very top of getting every vaccine that we can get and getting that in the arms of individuals. 93% of the vaccines that we have been put into the arms of individuals. We will continue to make sure that we work to get more vaccines every way we can, and we are working around the clock. And once we get them, to make sure as soon as we get them, they are promptly put in the arms of those who need it most, and eventually all of us, right? With that, I'm going to introduce Dr. Robert Levin. He's our public health director, and we'll get on with the rest of this press briefing to talk about how our county is responding. Thank you all so much for doing what you can. Appreciate it. Dr. Levin.
Good afternoon, everyone. I want to start out today by talking to you about the most recent numbers. Our new cases are 334. Those 334 cases are fewer than we've seen recently. It's a downward trajectory. I'll show you a graphic of this in a bit. We have seen 5 additional deaths which are individual tragedies to every family involved. And that brings our total deaths to 634 deaths. We currently have in the hospital across the entire county 318 patients with COVID. That's 2 less than yesterday. We have 79 patients, 79 of those are in the ICU, and that is also 2 less than yesterday. The other thing I wanted to touch on is that our effective, which is a number that some of you are acquainted with, that's the average number of people who are infected that infect others. And the median is 1.0. If we see more than 1.0, we're seeing an increase. If we see less than 1.0, we are seeing a decline. And ours is 0.83. So it is consistent with the decline that we're seeing in numbers. Our doubling time, which I'm not going to go into trying to explain, is 67.6 days. It was in single digits a couple of weeks ago. So that is also a major improvement in how we're doing in our county. I'm going to come back to this slide and, oops. Okay. Oops. Let's go back a couple. All right, we'll stop there. I also wanted to talk about second doses of vaccine. As you may know, we have Pfizer vaccine and Moderna vaccine in our county. The Pfizer vaccine should be followed after the initial dose 3 weeks later with a second dose. The Moderna vaccine 4 weeks later with a second dose. However, you are given by the manufacturing companies and the Center for Disease Control up to 6 weeks from that first dose to get your second dose. There's nothing magic about getting that dose on day 22 or 20. Just so it's within that 6 week period. And in fact, the CEO of AstraZeneca, a third company, and this is out of England, has found that the vaccine that AstraZeneca produces does even better in people when the second dose is at 3 months and 4 months out. Would that apply to other vaccines? The answer is almost certainly it would. It's also true of measles, mumps, rubella, hepatitis vaccine, all the other vaccines that we use. Consistently, that's the case. And so if you wind up having to extend beyond the amount of time that you thought it would be, 3 weeks or 4 weeks, don't worry about it. In fact, you might find some reassurance in that. The other thing I wanted to touch on is once you've had your shot, it means one thing, and that is you are less likely to get sick from the COVID virus. The consequence of that, of course, is that it contributes to what we call herd immunity. So you're contributing to an end of this pandemic spread of the disease. But nevertheless, the main thing you're getting out of this shot is you're less likely to get sick from the COVID virus. Let me just talk for a moment about the difference between being sick or diseased and infected. When you get a virus or a bacterium on your body, you're infected with it, but you're not necessarily symptomatic. You have no symptoms while it's growing up in you. It's only when it does, and if your body doesn't have resistance, that you develop symptoms or disease from it. I mentioned the one benefit of this. However, when you get the vaccine, it's important to keep in mind you could still get infected. You can still infect others. That means if you come in contact with someone who's got COVID, even though you've got this vaccine and the antibodies that it's created in you, that virus can inhabit your nose and your throat. It will probably not get anywhere near the big numbers that it would if you'd not had the vaccine. But during that period of time, nobody knows how long, maybe 2, 3, 4 days before your body gets rid of it. During that period of time, you could possibly pass it on. It's not proven, it's theoretical, but it's quite likely that you could do that. And so it's important that you realize that the protection you're getting is internal protection. It's not external protection. It's not put a coat of Teflon on you. And so you still need to mask. You still need to socially distance. You still need to avoid gatherings. And you still need to wash your hands. And all this brings me to the Super Bowl. Super Bowl's coming up. It's really important that we not allow the Super Bowl to do to Ventura County and the rest of California and the nation what Thanksgiving and Christmas did, and New Year's. So please, let's only celebrate and watch this game with our own household. Let's not have parties. and let's move it outdoors if you're going to be with someone else, and wear a mask and stay 6 feet away from them. Christmas and Thanksgiving, they're important. I understand, and it's understandable that people couldn't resist getting together sometimes. But I think the Super Bowl's at a whole different level. This is the number of cases that we've seen over the last couple of weeks. You can see that it's falling. Let's keep that trend falling. That last number is a number that is still probably 6 or 8 or 10 times higher than what it was when this whole surge began. We're still way, way higher than we were before. And so the danger is still there that people you spend time with are infected, and it can be passed from one person to another. So, thank you very much. I'd now like to introduce Barry Zimmerman. He's the Chief Deputy Director of the Healthcare Agency. Good afternoon.
Levin. I'm going to give you the current status of our vaccination efforts at this point in time. And so I'm going to start with some numbers that we have, and these are updated as to today. To let you know that on our website that many are familiar with, VenturaCountyRecovers.com or .org, is a dashboard showing our progress on the number of vaccines we've issued. That dashboard will be updated on Monday, Wednesday, and Friday by noon each day. We anticipate that being updated so you can follow the progress. As of today, with the numbers closing yesterday, but for our update today, we have vaccinated or administered 80,564 vaccines. Of those vaccines, 14,613 have been second doses at this point. So those are our current numbers, and we see a positive movement in that, and I'll go into details a little bit more on the quantities of vaccines and our pace associated with the rate of vaccination. I want to remind you that we are currently still in our first phase of vaccines targeting the healthcare industry as well as seniors that are 75 and older. I'll show you a little timeline here, or graphic, indicating the phase we're in currently. The positive news is of the 80,000 vaccines we've issued or administered thus far, 21,358 of those individuals have been seniors over 75. Which is tremendous progress relative to where we were a short time ago. I think our last report, just within last week, we were around 13,000, and now we're well over 21,000 seniors. So the progress is moving quickly in that, and that's a positive sign for our efforts to vaccine those most vulnerable currently. That's about a 37% of our estimate of seniors in that population. So that's encouraging news for us that progress is being made, and as we evaluate further on what phases and who next we can allow access to the vaccine. I just wanted to remind you that we are aware that the demand is high, and our supply of vaccine from the state has been limited. And I just wanted to cover a little bit of the modeling before I get into some detail on how that works within our county. And I'm going to show a slide up here just illustrating a modeled approach on the volume of vaccine we would like to have in our county and give you reference of what we currently receive. Our goal is to build up herd immunity through vaccination efforts. If we use our population and say we're going to target some 600,000 or even around 500,000 individuals to receive the vaccine, we would be talking with first dose and second dose anywhere from 1 million to 1.2 doses of vaccine to be administered. If we wanted to achieve that goal within a 6-month period, we would have to be receiving a weekly volume of anywhere around 45 to 50,000 plus vaccines a week. That is a significant number of vaccines on a weekly basis. As you probably have heard in various reports in the news and others, that we have been struggling to receive enough vaccines. We would like to receive volumes in that quantity so we could accelerate and reach more people. However, on average, we receive about 10,000 vaccines a week. So we're only at 1/5 if we were anticipating to vaccinate individuals within a 6-month period. So until we can get our vaccine volume and receipt at a high enough level, there needs to be patience in our rollout, and it will elongate the total horizon. So we should have appropriate expectations in order to understand that our system is limited by the supply we have. I did want to cover a little bit then on the distribution system and explain that to you in a little bit more detail, since it is confusing because there's multiple outlets for vaccines. Some we control and others we do not. There is a federal pharmacy program that is underway, and many have heard about that. That federal pharmacy program contracts with Walgreens and CVS in order to issue vaccines for a targeted population. That population is the skilled nursing facilities as well as those that reside within the long-term care facilities. That is their focus, and that is the population that they are working through. Not all long-term care facilities qualified for this program or were able to sign up. So the public health has developed mobile teams that is reaching out to those long-term care facilities that are not being serviced through this federal program. In addition to the federal pharmacy program, there are vaccines that are allocated to what we call multi-county entities, such as Dignity Health would be considered one, Kaiser Permanente is another. And so these large multi-county health systems work directly with the state to receive vaccines in order to also serve the community. Currently, these, what we call MCEs, have been focused in on their own health community within the health industry, and that's appropriate. Some of them have asked to also reach out to patients and individuals that are within their system of 75 and older, and we have allowed that. They are to work in concert with the local health policies and what levels we are offering the vaccine to at this time. In addition, and what you hear most of is the vaccines that are received by the local public health department. And those vaccines that we receive are only 10,000 weekly, go to supply the Thousand Oaks vaccination site, the Fairgrounds vaccination site, a South Oxnard location, as well as other provider partners that are involved in helping administer the vaccines, and those include a number of local pharmacies as well as clinic providers through our own clinic system and that of CMH, Community Memorial Health Systems. So that gives you an understanding of the network that is occurring, and thus it does cause some confusion on where to get vaccines, or hearing that someone may have received a vaccine through this organization or this method. I just provide that to clarify that every provider and an entity that is receiving vaccines has a responsibility to work within the parameters of the local health policy, but also within the guidelines of why they're receiving the vaccine and who they should target. For us, in the majority, is that if you are seeking vaccines, you need to be within the population that we're targeting, and you can access appointments via our web portal, which is found on the county's website, VenturaCountyRecovers.org, or you can go to the phone line that was referenced by Supervisor Parks. Both are valid ways to receive appointments to receive a vaccine. I do want to remind that we do run out of availability. In the county, we have decided that we only offer appointments based on vaccines that are available. We did not try to guess on what our vaccines would be week to week. Thus, appointments come available on a weekly basis when we secure the supply from the state. We've chosen to use that methodology, so we did not have individuals scheduling appointments in advance and then having to cancel that, of which we are hearing around the state that vaccine supplies aren't coming in as planned and appointments are being canceled. We are only scheduling appointments as vaccines are available, so if you have an appointment, a vaccine will be available for you. In that context, there's two appointments that you need to be aware of, the best I can describe it. Many have already received their first appointment and now are waiting for their second appointment, and I would like to go over how the second dose will be administered at this point in time. We are aware of those that have received and when they have received the vaccine, and so we will be sending out a direct communication to those that are eligible for their second dose appointment. That has already begun, and we are sending that out with a link associated with appointments that are available to receive the second dose. We started that yesterday with the Moderna vaccine, and so messages are going out in order to notify you and link you up with an appointment. Today, those that received Pfizer and would be eligible for their second dose, we are sending out those notices today and throughout this week to schedule you for a second dose. We are aware that we do not have all the supply we need, and so we are scheduling as many appointments as we have available vaccines and as quick as possible to get you within that 2-week window. That is our goal. We have advocated at the state strongly with the support of the Board of Supervisors and other local representatives to balance out that we may receive our second dose vaccine in the same quantity that of those that are eligible to receive it. So that is to say that you will receive a direct contact, and those that do not have a registered email address, we have a phone contact. We'll be sending out a notification that you may call for an appointment. Also, that with the second dose appointments that are going out is not competing with the first dose. So we may have closed first dose appointments because that's all the vaccines we have allocated for first doses. We will still be sending out notices to second dose appointments based on the allocation and vaccine we have for second dose. So as we move forward, it's important to understand that we are working to incorporate both first dose strategy and second dose strategy in our system. To do so, we also need to expand our distribution model in order to meet now what will be basically a doubling output of vaccines with the incorporation over time the second doses. So to do so, I wanted to make you aware that we are working on additional sites to stand up vaccination sites in different areas of the county. We're looking for an additional site and working on additional site in Oxnard, as well as one in Camarillo. Santa Paula and the Ojai regions are the 4 areas we are concentrating right now. This doesn't mean that we may change, or also we might have special needs to open additional sites or targeted sites, which we will do so. In addition, we are looking on anticipating moving forward in our progression of phases, so we will be running specialized pilot programs and so forth to see how best to meet special needs populations, in particular how best to work with those in the agricultural community and other areas that are more remote in accessing the vaccine. So in the future, I hope, in the real near future, I hope we will be able to communicate when those will be open. In addition, we are planning on how to move through the phases, and that information will be forthcoming shortly. I hope that you can always reference the website. Has current information. It has information about the vaccine as well as the availability of appointments. I recognize that appointments are short and oftentimes do not meet the demand, and I would say most times do not meet the demand, but it is a product of vaccines, and we are trying to encourage the increase that volume. So that concludes my remarks today, and we thank you for your patience and understanding of the issues that we have hand. Our goal is to get vaccines to as many people as possible, as quick as we can. We're very appreciative of our seniors and those that have received vaccines. I know it has taken assistance for individuals to get to some of our locations as well as to work through them. We try to accommodate everyone's needs as best as we can. But I'm very appreciative of many of the positive comments that come from our senior community that have recognized the efforts that have been made for their benefit and on their behalf. I would now like to turn the time over to Mr. Powers, the CEO of the county, to further go over more of the activities occurring with COVID.
Well, thank you, Barry, and good afternoon, Ventura County. So some very positive news there in the numbers. 80,000 vaccinated, that's good progress, and over 21,075 and over. So again, very good progress, but we know that's not enough. We want to have vaccines for all in our community. And so we're continuing to work in areas. What can we do about it here? What can we control? We can control our infrastructure and advocacy. So in terms of the infrastructure, we have good capacity now, and as you heard Mr. Zimmerman say, we're building that, continuing to build it. And just as an example of our ability to do it, we are just on the verge of now conducting right around 1 million tests in our county. And so I think we have a proven track record of being able to build our capacity and logistically provide this kind of service. And some may say, well, we only have a population of 850,000. Well, of course, that's because many people get tested more than once. But again, almost 1 million tests, and that shows that capacity. And again, it's not enough. And we know many of you are waiting, but we appreciate the emails and the letters and so forth we get with concerns and ideas and positive comments as well. In fact, we just got one the other day. I'd like to share it with you. And it's from a gentleman. He says, I got my shot today, and I will have my second shot a day before my birthday. It felt like I'd won the lottery, or at least scored on a big scratcher. I didn't realize the anxiety I'd been hosting, and now that has evaporated. The fairground operation was running like a clock today, a very friendly clock. It couldn't have been more efficient, nor the staff more helpful and friendly. I was there with a raft of geezers who all left smiling, so a big something in your life is going very well, thank you. And we so appreciate the positive experience many are having, but we know many are waiting. And we also want you to know there are resources out there for you today. If you want to talk to somebody, if you need food or transportation or whatever resource you may need, please go to our vcrecovers.org site. There are resources available for you, or you can also call the Area Agency on Aging at 805-477-7300, 477-7300. In terms of advocacy, so you've heard some of it, but we are on multiple fronts. Public health, Dr. Levin, Rigo Vargas, interacting directly with state public health, requesting more vaccines. Our board of supervisors. We're part of a statewide organization of 58 counties called CSAC. And we're also fortunate that we sit on what's called a kitchen cabinet. What is that? Well, there's a small group of counties, about 10 of us, who are able to have direct access to the governor's office and to Dr. Gawley. And we meet a couple times a week to advocate directly, talk about our concerns and our needs, and I think that's very helpful. We have wonderful state legislators, Senators Limon and Stern, and Assembly members Bennett and Irwin, advocating for us regularly at the state level. That's a huge help. Our city partners, our mayors of our cities have been helping and writing letters. That unified voice with our city and county and state legislators makes such a big difference, and we're all leaning in together to advocate for our community to get more vaccines. And just recently, just before I came to this conference, actually, here we got some very positive news. We've been trying to get some additional second doses, and we were pleased the state responded back with over 14,000 additional doses that we're going to be receiving soon. So obviously more to come, but that's something where we really, really needed it, and they came through for us. So we think it's working, and we're going to continue that advocacy, poking, prodding, pleading, whatever it takes to get a vaccine here for our Ventura County community. Just two last points I want to highlight for you, and this next program I want to just take some time to really highlight for you is rental assistance. And I know we throw a lot of numbers and data at you. It probably feels like white noise sometimes, but I really want to draw your attention to this program. This is rental assistance of $52 million of rental assistance. You recall we did a program several months ago for about $11 million, which helped a lot of folks and a lot of landlords, a lot of renters. This is a big program, $52 million state and federal funding. And so we'll continue to message this with you, but the state portal is going to open March 15th. I want to make you aware of that. And a couple weeks before then, they'll also have a portal that'll allow folks who want to campaign, do outreach in the community or as helpers, because it'll take some folks some effort to actually apply and get advantage of this program. But just to remind folks what it will be for, it's maybe we can put the slide up there, and there it is right there. Thank you very much. So it will cover 80% of past due payments between April 1, 2020 and March 31, 2021. April 1, 2020 and March 31, 2021. So that's a good time period, and that's a tremendous amount of funds for our workforce, for our renters, for those most in need. It covers folks what they call 50% AMI, adjusted median income. What does that mean? For a single person, that's about $40,000. For a family of three, that's about $55,000 a year in income. So, as I say, it's a tremendous amount of resources that's going to be coming to our community, and we will continue to to outreach to you and share information about this program as we move forward. And again, that portal for that program opens March 15th. So more to come there. And then our business, of course, our businesses have been struggling. It's really exciting that we're back in purple now because many businesses are open. If we can see the next slide. Businesses are open in purple, and we really encourage you to take advantage of that. Just a quick highlight here again, the state business assistance program closes February 8th. So I want to make sure those who are eligible, that deadline is February 8th, so please take advantage of that. County's program we'll have more information, get board approved next week as our plan, our next board meeting on Tuesday. And then just the regular business assistance that Economic Development Collaborative provides in terms of grants and PPP loans and so forth. And the last thing I would say too is with the Super Bowl coming up, it's just a great time to get a great big takeout order or delivery from our local restaurants. They're in need. I was out on Saturday and saw many of the restaurants. People were out dining, outdoor dining, and doing it safely with distance and masks, and it was just great to see the businesses really being busy there. And Ventura County, you're coming through for your businesses, and we really appreciate that. And so just please take care, and we'll continue to stay connected. Thank you very much.